Good morning, everyone. I'd like to call this meeting to order of the Community Health and Services Committee for March the 4th. Today we're going to be discussing the Building Better Futures update, the CMHC affordable housing funding for 989 Langs Drive in Cambridge, an update on the consumption and treatment services, the HART Hub, and we'll be hearing a presentation from Paramedic Services on their annual key performance measures, indicators, and responses for 2024. To begin, I'd like to invite Julie Hale, Committee Clerk, to conduct the roll call.
Thanks, Chair. Regional Chair Redmond.
Present.
Councillor Craig. Chair Erb.
Present.
Councillor Foxton.
Present.
Councillor Harris. Present. Councillor Hunick.
Present.
Councillor James.
Present.
Councillor Liggett. Councillor McCabe. Present. Councillor Nowak. Councillor Salonen.
Present.
Councillor Shantz.
Present.
Councillor Babanovich.
Present.
Perfect, thank you. Councillor Williams.
Present.
And Councillor Wolf.
Present.
Thank you.
Thank you. As we begin this meeting, we are again reminded that many of our homes and places of employment in Waterloo region are situated on the land that is a traditional territory of Haudenosaunee, the Anishinaabe, and Chinatown peoples. We recognize and deeply appreciate their historic connection to Waterloo region, and we also recognize the contributions of Indigenous peoples have made in shaping and strengthening this community. We are grateful for the opportunity to live and work here and reaffirm our collective commitment to keep the promise that reconciliation takes place through learning and community building with the Indigenous people who continue to live here. We are all treaty people with a responsibility to honor all of our relations. Are there any declarations of pecuniary interest under the Municipal Conflict of Interest Act? None. We have no presentations. We have no delegations. And we have nothing on the consent agenda. Councillor McCabe.
I just was curious about the timing for this because originally in the agenda, were you about to address that?
My apologies, I was going to mention that at the beginning. So what we're going to do is work through until 12 o'clock, and then depending where we are on the agenda, if that's okay with everybody, we'll take a half-an-hour break and then reconvene. Does that sound okay with everyone? Oh, we will, yeah. So the first item, 8.1, the strategic priorities, homes for all. I'd like to call on Ryan Petitpierre, the Director of Housing Services, to introduce the report on Building Better Futures. Update and next steps. You're on, Ryan.
Thank you, Chair Erb, and good morning, Regional Council. It's good to have this report and presentation in front of you this morning. I've got about 6 slides that I will run you through, give you a bit of a context in terms of where we've been, where we find ourselves at the moment, and where we hope to take this work over the next 5 years. Go to the next slide again. Thank you. So as no surprise to any of you, we've got a lot of important work to accomplish in housing and homelessness. Work that has both a broad scope and is very complex in nature. And what helps guide us through all of that complexity and scope are our plans. So we've got plans, lots of plans. Plans that are intrinsically related and depend on one another for success in achieving homes for all in this region. You're well aware of our plan to end chronic homelessness that is at its heart looking to prevent experiences of homelessness whenever and wherever possible, and that when it does occur, it is rare, it is brief, and that it doesn't happen again. The plan I'll be speaking in more detail to you about this morning is our Building Better Futures framework that in its initial iteration was a vision of creating 25 new affordable homes in a period of 5 years. In the iteration that I'll be sharing with you through this presentation and report, we're looking to revise that target to creating 3,500 affordable homes in that 5-year period, with targets specifically to low and very low income households across this region. And related and nested within that Building Better Futures frame and vision is our Waterloo Region Housing Revitalization Plan. Brought an update to you in December of last year on this work. This is a plan specific to the housing stock that we own and operate and are looking to redevelop in the form of 6 of our sites to create at least 600 net new units through that process. Next slide, please. To show you how these plans are related and just having another look at them, I've shared this slide with you before, but I think it's helpful just again to go over the context, understand how these plans work together to accomplish a strategic vision of homes for all in this region. The top of this slide, you'll see housing continuum. So this should be familiar. It's a bit of a simplistic overlay of the housing system from homelessness on the left-hand side all the way through various other forms of housing up until market home ownership on the far right-hand side of the slide as well. I'll give the caveat that this does simplify a very complex system. We know in its ideal form we'll have enough supports and services along that entire continuum to support people wherever they are and help move them from left to right. It doesn't always work like that. People don't continue to move. People can stop moving. People can move backwards and forwards. But I think for illustrative purposes in describing our plans and how we target the work, I think it helps. You'll see underneath the continuum, there's a black bar that illustrates where the plan to end chronic homelessness sits in the areas of the housing continuum that plan targets. Beside that, you'll see a green bar that illustrates where our Waterloo Regional Housing Plan sits and targets. And underneath that, overlapping both the plan to end chronic homelessness and the Waterloo Regional Housing Revitalization Plan, we have the plan that I'm talking about to you in more detail today. That's Building Better Futures. That spans the continuum from supportive housing all the way through to affordable home ownership. So I think it's just good context to understand how these plans work together and support populations across the region in various different ways. Underneath those bars of the plan, we've got the places and spaces that constitute each form of housing that's laid out on the continuum in terms of the stock that we support in those various forms. And underneath that is a percentage of the budget that is allocated to each of those forms of housing. So I think this is just a good reminder and illustration not only of how we target our frameworks and our initiatives, but how we target the budget to support those initiatives along the way. And you'll see that, again, the lion's share of investment and effort is trying to solve homelessness overall in the forms of permanent housing. That work being done through Waterloo Regional Housing Revitalization Plan and our work in Building Better Futures. Next slide. Thanks. So to jump back to Building Better Futures in its original iteration, this was implemented in 2021 with really just it was a vision. It was a vision of doing more in the affordable housing space than we had done historically. When we looked at the numbers of affordable housing that we were creating, producing, or supporting in this region historically, we were producing about 50 units in any given year. We wanted to not only do more than that, we wanted to do greatly more than that. So we started with a vision of doing tenfold more in this space. And how we proposed to do that was looking at a number of creative and innovative approaches through funding grants, leveraging our own Waterloo Regional Housing stock, use of surplus lands, and increased use of portable rent supplements. We also had some significant funding supported by council to kickstart that effort to the tune of about $20 million in 2021 and 2022. And when we started this work, we didn't know if we were going to be successful or not, but we knew we wanted to try. And we knew that this region needed us to try. And the success that we have had to date has been not only through those innovative approaches that we've taken, but also how we've organized ourselves internally. The way that we do this work is completely cross-departmental, and it's a corporate priority. It doesn't just sit with the Housing Services Division. We've partnered directly with the team in PDLS and Build Waterloo Region. We also have incredible support from the rest of the corporation, whether that's facilities or legal or finance. That list goes on and on. With our current strategic plan and the strategic priority of homes for all, this work is a corporate priority, And we continue to look at and use the entire energy of a corporation to accomplish this work and find new ways of doing so as well. Next slide, please. So in hitting our target about 3.5 years into a 5-year initiative, our attention really turned to the question of where do we go from here? And so that started with an analysis of what we had, not only what we had accomplished, but how we had accomplished it. We then did engagement work, a whole lot of work with the with community, with area municipalities and others involved in this space, doing a lot of listening and getting a lot of feedback. And all of that is rolled up into the reports and plan that we have in front of you this morning. We've kept everything that worked well through its original version. We made improvements to what didn't, and we've incorporated new ideas, emerging and promising practices along the way as well. In addition to some of those new directions that we're going for, I want to highlight some changes in scope, both in terms of the quantum of what we're hoping to produce, but also for whom we want to create these homes for over the next 5 years. It was important to us as an internal staff team that we not only continue to produce and support the development of new homes at the pace that we've been on, but to continue to find ways to push that pace even more. I spoke on the importance of this work to this community previously through our original vision for building better futures. And while the environment that we find ourselves in today, this work is not getting easier, but it's getting more critical that we continue to find ways to push and go beyond what we've already achieved. So we don't want to just maintain the previous pace that we were on. We want to push further, and we want to push ourselves more to do this work. One of the ways that we think we can accomplish this is through looking at preservation of existing affordable housing. This was not a focus in the original iteration of this work. And what we've seen over the last number of years in this country and in this province particularly is a lot of data coming out that's illustrating for every new unit that we're creating, we're losing some exponents more than what we're producing of the existing stock. So we want to pay particular attention to that area in this new iteration. We also think that given our role as service system manager, our connection to income support and public health programs, it's critical that we focus our efforts on the low to very low income households in this community. And you can see on this slide definitions of what we mean by those. So some change in scope in terms of continuing to push our efforts in this area to achieve even more, and some narrowing in of scope on who we want to target these affordable units for overall. Next and last slide, please. So with this revised scope, we've come up with a framework for the new actions to get us there. This includes continuing to incentivize affordable housing development, increasing overall community capacity to do this work and support this work, preserving existing affordable housing, further utilizing our Waterloo regional housing assets, disincentivizing the financialization of housing, and continuing to refine and build on how we work together as a region, a regional corporation, and a regional community. Thanks for listening. Happy to take any questions you have on this work.
Thank you. Councillor Shantz.
Thank you. Thank you for the update. I was a little bit preoccupied trying to get my computer up and running while you were talking, but I think I got all of it. I just wanted to commend you and your staff on continuing to look at the issues and how you can address them well. And I particularly like the graphics. I think they tell the story really well. So the graphic with the continuum, the numbers that you've got on there are current numbers of housing, I think. Is that? Let me see if I can pull it up too.
Go ahead. Sorry.
Yeah. And so through you, Chair, and yeah, maybe we can get that slide back up. So those were, before. I think, towards the end of the year, those were current. There's probably some slight adjustments, Councillor, that we could make. There's some old census data that's on there as well, but they're they're what I would call reasonably current overall.
So I mean, obviously, you have been looking at the data, and the need is in supportive housing, particularly if it's low and very low, or where do those where does that focus fit on this graph?
Yep, thank you, and through you, Chair. So when it comes to supporting the work of the plan to end chronic homelessness, and if we're going to be successful in that work overall, supportive housing is critical to those efforts. It's not needed by everybody that's experiencing homelessness, and it's not needed by the majority of people long-term necessarily either, but it's a critical step, and it's an area that we want to focus on, particular for that population. When it comes to low and very low incomes across the region, that's not just people that are homeless either. It's people that are struggling with where they're at right now and their ability to pay their housing costs. So it's supportive housing for sure to help us be successful in the plan to end chronic homelessness, but community housing and affordable rental housing are also really critical components for that low and very low income group that just needs support in their ability to pay the rent overall. So it's a group that would span that range of the housing continuum overall in those various different built forms of housing that assist.
Yeah. If I can push a little more just to understand the quantum. If you were to take, so this is what we have, if you were to take the situation where, I mean, we're saying we've got 2,500 homeless people, if you were to take the actual situation and put numbers in there, where are we the most lacking? And I'm assuming I know the answer because of your report, but.
Thank you. That is the billion-dollar question, Councillor. I think the stat that best illustrates the need overall, it's not the wait list or it's not the number of people that are currently homeless. It's core housing need. When we look at core housing need is a measure of people that are paying more than 30% of their income on their gross income on their current housing situation. That's a population that's struggling to pay their housing costs on a daily basis and are most at risk of becoming homeless or entering the system one way or another. When we look at census data, such as we have, it's about 20,000 individuals across this region. It's a staggering number. Wherever we invest along the continuum, it's going to help out. It's going to create more capacity. And I think the sweet spot for us in this work, both through the plan to end chronic homelessness and through the work of building better futures, is on the continuum between supportive housing and affordable rental housing. That's where we need to be putting our efforts. That will free up additional capacity and need and demand for our Waterloo regional housing stock. It'll help prevent people from entering into homelessness to begin with. It'll help them exit homelessness overall. So if we can target that area of the continuum, as we're pointing to in these efforts and how our plans work hand in glove together, that's where we should be putting our energy and our investment.
Okay, can I ask one more? Thank you. So there's two pieces to that. There's one, if you've got people that can't afford their rent, but maybe have a space, so that's where we may provide some rental support help. And then there's the lack of actual rental space. How do you balance those two?
Yeah, thank you again. So yeah, it's a constant balancing act. So as you've seen through this work of our WRH revitalization plan, we're taking some ownership and some leadership in building the spaces ourselves, which is needed and necessary for the population. Also for like a sustainability and longevity standpoint as well. They'll remain in the system as intended in perpetuity that way. We balance some of those efforts and the cost that's associated with doing that work out with things like rent supplements. So those are spaces that already exist out in the community in the form of private or not-for-profit landlords. And then we're able to assist somebody either in their current situation or to move into that situation by paying the difference between what they can afford and what the actual rent is at those spaces. So it's a balance between supporting the creation of new spaces and also utilizing what's out there in the market right now to the best of our ability and operating on both of those fronts.
Thank you, and thanks again for all the work you're doing.
Councillor McCabe.
Thank you, and just want to echo what Councillor Shant said about, congratulations on hitting the marks early and being ambitious with the next go-round. I think it really speaks volumes for the work that you're doing and the partnerships that you've developed, so thank you for that. I have a few questions. One of them was just to understand, there's a paragraph about municipal right of refusal policies. And I just wanted to make sure I understand that. Does it mean that without provincial legislation, municipalities can't purchase a single-family home if it's bidding against like an individual who's trying to purchase a home? Or does it mean that without the provincial legislation, a municipality isn't automatically the successful purchaser? There's a paragraph, I didn't mark what page it's on, but you know what I'm referring to? Okay.
Go ahead.
Yeah, thank you, and through the chair, it's closer to the latter in your question, Councillor McCabe. So this is a policy that exists elsewhere in the country, Quebec as one example. And what it means is that when a property, if the province was to enable the legislation here, it would allow that when either an affordable or otherwise property came up for sale, the municipality would get the first shot at purchasing it for the fair market value of the property. The municipality could take that or could decline that opportunity, depending. But it would give the municipality the first right to preserve housing stock or to take on additional stock that happens.
And that could be any type of, like a single-family home, a three-story apartment, like it could be any kind of?
Yep, depending on what the province would choose to enable, they would have to table the legislation and spell that out specifically. They could target it to various built forms, I suppose, but that opportunity would be there. So first step would be the province would have to enable that. And then it's, if supported, then it would come to the area municipal level to follow that up or not. So it's a policy that we've been watching. It's one that we're interested in. We think it has a lot of benefit in terms of preservation of existing units in particular. And we've seen where other countries have engaged in this type of work in affordable housing is more successful. It's policies like this that help that and eliminate some of the competition, bidding wars and price escalations that happen when properties go up for sale elsewhere.
And so have you had conversations with ministry staff about this? And I'm just wondering, do you have a sense of where this may or may not be in I know we just had an election and that, but is this something that we've put forward and we've heard a hard no, or are they open to hearing about this? Or do we know?
Go ahead. Through you, Chair. I'd say at this point we don't really know. It's been interesting times with the ministries lately. There are conversations that we're open to, and it's something that we'd like to pursue either through a staff level or even a council advocacy level in the coming years as part of this work to understand what the appetite might be for something like this.
Okay, yeah, that's okay. That's good to know. That's really good to know. My other question is, what do you mean by the de-incentivization of the financialization of housing? I mean, in terms of, I know what the financialization of housing means and what's happening, but what is it that you are thinking that we can do or to address that?
Go ahead.
Because that's a big challenge.
It absolutely is, and it's one that we think that we can have a role in, both again through advocacy and direct policy implementations ourselves. So, the initiative that we were just speaking of, for example, that would help contribute to the de-incentivization and financialization of housing overall. Also, the more that we are able to maintain and retain housing stock ourselves as regional or not-for-profit entities, that also further contributes to that work. And again, where we've seen countries that have really embraced affordable housing, we see like those levels of government really playing a strong role in ownership and retention of the community housing stock.
Okay, thank you. And I had a couple other questions, but I don't know if anyone else was in the queue.
There's no one else in the queue, so you're on.
Keep going? Okay, thank you. So I also wanted to ask a question about rent geared to income and the process by which, so yesterday with the MP in Waterloo, we had a meeting with a variety of people who live in some of them, about half of them live in region of Waterloo housing, and then others live in privately owned apartments or townhouses. Not great situations. But one of the things they asked was, because some of them are living with rent geared to income. But how they explained it to me was that, you know, for them, the incentive to go, in some cases, get a job or improve, you know, or take a promotion or get a, you know, a higher paying job is offset by the fact that their rent, their rent will immediately start to rise, and doesn't allow them the opportunity to save in order to save money to either make a down payment on a house or a down payment for a better apartment or what have you. So is it within our purview as regional council, like from a policy perspective, that we could take a look at that and say, you know, if that's the situation, that we would allow you, I don't know what the time frame would be, 6 months to a year, at the same, paying the same rent, and to allow someone the opportunity to do that? Or is that legislated again by provincial legislation?
Right.
Or have we tried that and it doesn't work? And just tell me curious about that.
Yeah, thanks for the question again, Councillor. It's a growing concern. It has been a significant change in the overall rent geared to income housing stock over the last decade or so. It was never necessarily intended to be a lifetime sort of situation for individuals, but meant to stabilize them until their income situation improved, and then move on to market housing. What we've seen in the market over the last 5 to 10 years is that even when people's situations stabilize and their income improves, there's still nowhere for them to move in terms of affordability after rent geared to income housing. And that's created a lot of the backlog across that housing continuum that ultimately winds up in the significant homelessness challenges that we're all seeing. We have the whole calculation process and rules that govern how we operate rent geared to income housing is legislated by the province, both in terms of access. We have no ability to force somebody to move on. What we do have the ability to do is to provide programs and incentives that help with that work too. We created an enhanced home ownership program a number of years ago to try to do just that. We partnered with one of the local credit unions as well as our own home ownership program and try to work with our tenants that have gained that level of income to help support them into what comes next. We've had varying degrees of success with that approach. But I think that or other program or policy changes that we can make to incentivize and support somebody, to your example, into that next step would help with that flow through and create better positive movement through the housing continuum that we see currently. So that's where we have the ability to play or to make changes, is really with that support and incentivization pieces to help people that are ready to move to what's next.
Okay, thank you. I wasn't aware of that enhanced home ownership piece, so I'll share that with them.
I have some other people in the queue now, Councillor.
Okay, can I just finish this question and then I'll go back in?
Okay.
So if I understood you correctly, if someone does get a job with an increased salary, we don't have a leverage to tell them to move out anyway. Is that what you said?
Essentially correct. So when they're in a rent geared income situation right now, say paying through their social assistance, say they gain employment and are now working, we would shift their rent so that it's now 30% of their new income source up to a maximum cap. We call that market rent. It's not actually equivalent to the market. It's also deflated by provincial legislation as well, but they would be paying the maximum rent that they can in that rent geared income situation. And no, we have no ability beyond that to force them to move on from there.
Councillor James.
Thank you. I just want to thank staff for the report on this and being so thorough and all of the efforts happening. I would like to move this motion, and Councillor Foxton will second that.
Moved by Councillor James, seconded by Councillor Foxton. Do you have some comments now, Councillor James?
No, that's all I wanted to.
Oh, okay.
Can I call the question?
Well,
There's still speakers in the queue, so I don't want to.
I do have a couple other people on the queue here to speak. Councillor Hunick.
Chair, I'm glad the motion is on the table, and I'm glad it's going to be seconded. And I just wanted to clarify something that Councillor McCabe asked about when your income goes up and your rent goes up. That's true, but it is at a maximum of 30%. Is that correct, Mr. Pettigrew? So regardless of how much you make, the ceiling of your rent payment and rent geared income is 30%, correct?
Through you, Mr. Chair, you're correct, Councillor. So all of our rent geared income units, people are not paying more than 30% of their income at any point in time.
So there is still incentive for people to get better employment when they can. It's just not as much incentive as if we offered a break, but it's still a fairly good incentive in my opinion. Thanks.
Okay.
And just one final, sorry.
Okay, you're recognized.
Okay, thank you. I can't let a discussion about building better futures go by without asking about 555 Beechwood. I just want to, my understanding is it's with the city, but once that's done, we're ready to move on it, correct? So that'll...
Correct, Councillor. There's a few agreements with the city right now. We're waiting to be finalized, and if those are done soon, we can keep moving to the next steps, which would be a final site plan approval and hopefully a building permit.
Yeah, okay, that would be great. And I do want to put on the record that, again, at this conversation that I had with these individuals at Sunnydale yesterday, we need to take a look at the state of regional housing, particularly in that area, because some of the issues that they raised were quite shocking. So I have followed up with Councillor Erb about that, but I do want to put on the record that we do need to take a look at that, because there's a wide variety of outstanding issues that were really quite shocking to hear about from the tenants. Thank you.
Okay, we have a motion mover and a seconder, and I don't see any other hands raised. When Building Better Futures came to council in 21 with a target of 2,500 homes in 5 years, it was sort of, oh, wow, that would be wonderful. Well, here we are coming back now with 3,500, so it's another wow and more wonderful. So great work for the innovation and the strategic alliances that hopefully we're going to be able to build to make this work. And particularly for the focus on the low and low income people in our community, that we're able to maybe start making some progress there. So great work, and thanks for pushing this thing out, having the vision to really make this something worthwhile in our community. Would you use your e-scribe to vote? My clerk wants me to move on. I'm waiting for my cue. Oh, but yeah, I'm in favor of it. It's carried. Thank you. On to agenda item 8.1.2, CMHC Affordable Housing Funding for Waterloo Region. You're on again, Ryan. Go ahead. Fiona. Oh,
Can I just interrupt for a second? I'm in favor and I am in attendance. I wasn't sent the queue. And nobody asked me how I wanted to vote on that last one. So could you remove me from being absent, please?
okay. Okay. Yes, we will.
Thank you. Thank you.
So, all right, is this where we are now? 8.12, Ryan's going to introduce. Am I on the wrong one? No, I just thought Fiona was going to do it. Are you going to start this, Fiona? The 8.12 CMHC affordable housing funding for Langs Drive in Cambridge?
Ryan, maybe you just want to introduce what we're doing here, and then if there's some legal or financial questions, we can defer to Fiona and Wayne if necessary. Is that fair?
Yeah, no problem. Happy to
Sorry.
introduce this one. Yeah, so this is a report with a recommendation recommending that we proceed to enter into an agreement with the Canada Mortgage and Housing Corporation. This is a new way of doing business with our federal government through this stream, and has been the result of a number of years of advocacy on our part. We've always been able to accept grants from the Canada Mortgage and Housing Corporation. That's how we have funded several of our Waterloo Regional Housing revitalization projects to date. What we have not been able to do, though, is secure some of the very favorable loan terms that the federal government also offers us. And the reason that we haven't been able to access those portions of what they have on offer is because we don't have the ability to take out a mortgage as a regional municipality. So we have been advocating for them to consider changes to their policy to secure against a debenture model, which is something that we are able to do. So after a lot of years of work, we're now able to access that. CMHC has provided the terms in the report that's in front of you this morning. Both grant and loan terms are very favorable and will save us considerable amounts of dollars than what we had been able to access on our own through lending markets. So this agreement would allow us to enter into this deal with the federal government for our revitalization project at Langs. So we'll now have the loan component attached to it, which is different from our first two projects at Kings Court and Wilson Avenue. Hope that helps understand what this is and what the report in front of you is speaking to.
Thank you. I have three councillors. Councillor Fox.
Thank you, and through to Ryan. So we have this in air where a community group got together and received a loan and did Kirkwood Apartments, and you have some housing units in there. And it worked very, very well, and they paid off the mortgage and they run the apartments well now. The thing I wanted to ask about this is if we are doing the rebuild, what happens to the residents that are there while the rebuild's taking place?
Mr. Pettier.
Yep, thank you, Councillor. So all of our rebuild projects go through a significant relocation process. It's challenging work for staff and the residents. Langs, every tenant that was there previously has been successfully relocated while this build happens. They also get first right to come back to the brand new building, again under rent geared to income terms when it's finished. So the short answer is tenants are relocated. They're supported financially as part of that relocation process. And hopefully we get to welcome them back to a brand new and improved building when construction is complete.
Thank you, and well done. And one final comment, there's a youth and teen center built within it. Will that be established in the new build as well?
Through you, Chair. Yeah, we've done some really cool work thanks to some staff that are here today in working with youth populations at this building in particular. We established a youth committee to help us through the design process and learned a lot from them along the way. So yes, there'll be youth-specific centers and hubs here at this site. And I think it's a really nice feather in the cap of the folks that have been doing this planning work at this site to enable that.
Well, I want to thank you for doing all of this, for taking care of those that have to relocate for some time, for making sure they're taken care of, for welcoming them back, to creating even a better center. So well done. Thank you so much.
Thank you. Chair Redwin.
Thank you, Chair Erb. I would be happy to move these recommendations, and I would just underscore this is a long time coming. This has been a lot of heavy lifting by our staff, and Langs have been an outstanding partner for a very long time, so I'm sure this will be successful. And the only way that we've reached the threshold of a Better Futures number when we went from 50 units a year to what we see 3,700 and counting now is because we have partners like this. This is a great development.
Mm-hmm. Councillor McCabe, you were seconded? You're second, okay. Any other questions, comments? None? Use your e-scribe to indicate your support, please. It's not showing up. I vote yes.
I vote yes.
It's carried. Thank you. More good work. On to item 8.2, equitable services and opportunities. An update on the consumption and treatment services. We have a number of community partners and staff from the region here. Dr. Wong, do you want to introduce the report, please, and the people that are going to be presenting? Katie McDonald, Tara Taylor, Jen Scott. Welcome.
Yes, thank you, Chair Erb and Council. So today we have an update for Council on the wind down of the consumption and treatment services site and the startup of our HART Hub. Katie McDonald, one of our managers in public health, will review the CTS closure and provide a mitigation strategy update. The HART Hub co-leads Tara Groves-Taylor, the CEO of Community Health Caring, Kitchener-Waterloo, and on behalf of House of Friendship, Jennifer Scott, Housing Services Director, will share an update and their plans for opening the HART Hub in Waterloo Region. And finally, Lindsay Sprague from Sanguine Health Center is also in the audience today. With that, I'll turn it over to Katie. Thank you.
All right, good afternoon. As Dr. Wong mentioned, I'm Katie McDonald. For the presentation today, I will go over the context related to the CTS closure and the initial HART Hub engagement process. I will also review how we are working with community partners, including the harm reduction work group, on a mitigation plan for the CTS closure. Finally, I'll pass it over to Tara and Jennifer to provide an update on HART Hub. Next slide, please. And there's the overview I just covered. So next slide. In August, the provincial government announced its intention to close CTS sites within 200 meters of schools or licensed childcare centers. This included the Kitchener CTS site. At that time, the province also launched the HART Hub demonstration project. CTS sites were given the opportunity to submit a business transition plan to become a HART Hub. Public Health, as the CTS administrator, and Sanguine, as the CTS operator, held community engagement sessions to discuss what a HART Hub could look like in Waterloo Region and identify leads. The community engagement sessions included partners from across sectors, the cities and townships in Waterloo Region. Given the requirements of the HART Hub model, which include supportive housing, access to shelter and transitional beds, mental health and addictions treatment, primary care, and case management, as well as feedback from the community, Community Health Caring Kitchener, Waterloo, and House of Friendship were identified as the co-leads of the Waterloo Region HART Hub. Both organizations bring a wealth of experience and deep commitment to addressing our region's needs. Next slide, please. Since its opening in 2019, the Kitchener CTS has provided an important service in our community and was part of a comprehensive drug strategy. We recognize and are very thankful for the dedicated work of Sanguine Health Centre. Recognizing the importance of harm reduction, Sanguine and Public Health also led conversations throughout the fall to identify potential impacts of the CTS closure and mitigation strategies. These conversations included many local agencies, partners from across sectors, and people with lived experience. From these conversations, a harm reduction work group formed to further identify and prioritize mitigation activities and develop a harm reduction strategy moving forward. Mitigation activities are underway and being planned. This group will continue to meet regularly to monitor initiatives and impacts and strategize future needs. Some activities identified by the harm reduction work group and underway include increased needle recovery through the WINS program, which is a peer-based needle recovery program run by Sanguine, ensuring naloxone is available to community through the Ontario Naloxone program, continued harm reduction support for shelters through the Emergency Shelter and Harm Reduction Integration Initiative, also known as ESHRI, engagement with police, paramedics, and hospitals, supporting training and education for interested groups. In addition, we are working with the Community Services Plan to End Chronic Homelessness Co-Creators Group to fund harm reduction projects through their collective investment process. Now, I'll pass it over to Tara and Jennifer to talk about the HART Hub.
Thanks, Katie. Through you, the chair, and thanks so much for having us today. I too would like to recognize the wonderful work that was done by both the Region and Sanguine through the Safe Consumption site. And it's unfortunate that the HART Hub is coming online by virtue of that closure. But we're so fortunate to be working closely with the Region and with Sanguine as we work towards implementation of the HART Hub. As Katie talked about, we worked very closely right from the initiation of the HART Hub proposal with the partners here in the Waterloo region, and we continue to meet regularly with them, as well as consult with them, as well as potential users of the HART Hub and current users of the CTS, as we try and build out the service model. I think one question that comes up fairly regularly is, where is it located? It's not located in one place. It is not a brick and mortar location. However, the anchor site is at Community Healthcare in Kitchener-Waterloo at 44 Francis Street. We knew here in Waterloo that because of the richness of the partnerships in this community and the amazing services provided by a multitude of partners in a collaborative way in this community, that leveraging those partnerships at those places and spaces was the right way for us to go as we bring the HART Hub online. So our model is built on leveraging those. So it will be across a number of different locations where we know people already have trusting relationships with providers and therefore will ease access into HART Hub as it comes online. This sort of lines up exactly with the integrated and collaborative model that we hope to roll out for HART Hub, because as we know, as we engaged with key stakeholders through surveys, some of the things that were most important to the community, to the service providers, and to the folks that we provide services to are concrete pathways into services for change-oriented individuals, coordinated services, and coordinated services that actually have someone coordinating from inception through the entire service pathway, which we know is not linear. In fact, I think we refer to it often as a bit of a, what does Michelle call it? She calls it a traffic circle, I think, so that you're coming in and out of it at various different points, and we want to make sure that people are supported throughout those different points. We also want to make sure that it's a self-guided, self-directed service option for folks, that they see themselves in it and they see their individual journeys in those HART Hub services, wherever they may be in their stage of change. By April 1st, we will have online our intake person or people, our coordinators, our care coordinators, the manager of our HART Hub services, or several managers across the partners, will be in place. And some of the key services that will be leaving our CTS location, like the Rapid Access to Addictions Medicine program, will move over to Francis Street for April 1st. We do know it will be a phased-in approach to HART Hub services, so that's what will be available at inception. We are working now to build capacity to share information across key service providers and stakeholders so that access will be easy for folks, particularly to mitigate the gap as much as we can from the CTS closure on March 31st. We made sure as we developed these services that we had services that crossed over into Cambridge as well as into our rural areas within the region. It was important to us that those pathways and that those services provided access to everyone across the Waterloo region, and so they are built with that in mind. We also ensured that there was an outreach and mobile component of HART Hub, as well as sort of access across regular hours, like outside of regular hours. There's an operational table in place now with the key funded partners in the HART Hub, and we are in the process of putting out an expression of interest for the strategy and accountability table that will sit atop the HART Hub. There's also a lived experience and community advisory table that are in the planning phases. I'll pass it over to Jen.
So here on the slide, if you can go back a slide, thank you. Here on this slide shows a little bit more in practicality what we're going to be offering here. So really we know that for people who are experiencing homelessness or precariously housed, have mental health challenges or substance use concerns, it can be hard to navigate the healthcare system. So the hub is really designed to help provide guidance, resources, and support for people along their journey. So we will be providing increased access and expanded hours to the services listed here. So primary care, mental health and addiction support, including the Rapid Access Addiction Medicine Clinic. We'll be providing culturally safe care for folks in our community, land-based supports for those who are Indigenous community members, mental health and addiction supportive housing, which I'm going to talk about just after I'm done this slide. Employment support. So for folks who are struggling to get back into work, we are supporting the employment needs. Community-based mental health support. And then the very lowest barrier would be immediate access to showers, food, laundry, and peer support. And that would be available with, again, as I said, expanded hours. So we know that our services are needed Monday to Sunday, all days of the week, not just on the working day. So really we're excited to be able to expand hours for folks to access service. With respect to the mental health and addiction supportive housing, $1.3 million of the funding has been earmarked for mental health addiction supportive housing. The Waterloo Region HART Hub will provide impact in this area in two ways: by creating a 12-bed transitional housing program and rent supplements available for folks to make permanent housing more accessible. The Waterloo Region HART Hub transitional housing program is designed to support individuals experiencing homelessness who are also navigating addiction recovery. Many people in this situation fall through service gaps, especially those transitioning out of detox or facing mid-level challenges. It makes it hard to access housing programs. So without targeted support, they risk relapse, declining wellness, and long-term homelessness. So this program aims to bridge that gap by providing short-term housing, addiction recovery support, life skills training, and a connection to community resources. Participants will have personalized support plans to help stabilize, build independence, and work towards permanent housing. There will be significant housing support on site to be able to transition folks from this program into a permanent tenancy. This program will support all genders and will be abstinence-based. We anticipate that people will be in the program for about 6 to 12 months. We believe that this personalized support plan and the significant health resources from the HART Hub will help people to successfully transition into permanent housing. We're still working through some neighborhood engagement, so I'm not able to share the address of this program just yet, but within the coming weeks, we will be sharing this more publicly and are excited to share this new program.
Thank you. Last slide. So in terms of next steps, the CTS is planned to close March 31st, 2025, and the HART Hub will be beginning services at that time. Harm reduction mitigation activities and strategies, as mentioned, are underway, and we'll continue to closely monitor and evaluate this change, along with community partners, including the HART Hub, emergency services, hospitals, and the harm reduction work group. Thank you.
Thank you for your presentation. We have some questions from Councillor James.
Hi, thank you. Good afternoon. Thank you for your presentation through you, Chair. A very key topic that I've had to navigate for a few weeks. So I do have a couple of questions just for clarification, and thanks for all your work on this in the short timeline. But will the HART Hub services be available to people who are not yet change ready in their addiction journey? What does that look like in terms of the work? And I have a follow-up after.
It's a great question, one that we chat about fairly regularly, because change orientation, as I sort of indicated earlier, is not linear. So that's how we're defining accessibility to HART Hub services, is a change orientation. However, it doesn't mean that the services that are currently available for supports don't go away, despite the fact those teams are evolving and having additional sort of services added to them, like addictions counseling and mental health counseling. So people will still be accessing the folks they trust, the folks they've built relationships with in the places they have those relationships, if they do. If not, they'll come through a different referral pathway. But depending on sort of where they're at in their journey is how it will be determined what those next steps to services are. Does that answer the question?
It does. Okay. Kind of leads to kind of my follow-up. So I'm aware that the funding was cut by 1.5 million. So how are we covering the cost of the essential services as a result of this funding gap?
The funding cut to CTS, you mean?
Yes.
Do you want to answer that question? Or do you? Okay.
Yeah, through you, the chair, I'll pass it over to Dr. Wong.
Sorry, just to confirm. So the funding. So the province will no longer pay for a CTS, but they will redirect that money to the HART Hub.
And that's the full amount that was initially directed to the CTS that's being directed to the HART Hub?
Yes, and in fact, the province is committing like more than the amount of the CTS. Approximately, they've announced approximately 3 times, but we don't have the specifics yet, so we're waiting still that confirmation. But yes, they're allocating, they're essentially reallocating the full amount that they would have paid for the CTS to the HART Hub.
Okay, and then, sorry, Chair, just as a result of that, I just have another question in regards to the employment piece. So the people who, it may be a challenge to be employed, and the CTS was employing them. Are there any things to mitigate that? I'm conscious of that because we're in a financial crisis with everything right now. What is being done for those potential loss of jobs, for those who would be a challenge to find employment otherwise?
Thank you. Through you, the chair. We do know that Sanguine and the HART Hub are looking at different opportunities for peer workers that do have challenges in other employment. Tara, do you have anything to add, or?
Yeah, through you, the chair, I can just say that as the positions are coming online, so as the postings across the partner organizations offering the HART Hub, we're ensuring that we're in close touch with folks who are currently working at the CTS to ensure wherever possible that we have opportunities that people can avail themselves of.
Thank you.
Councillor Hunick.
Thank you, Chair, and thank you for this excellent presentation. I think it's really interesting and innovative that we are not locating the HART Hub in a specific location and that we are actually utilizing pre-existing relationships with service. I think that's really awesome. Is that the model that is also being followed by other locations that have a HART Hub that we know of?
We're really fortunate, and thank you. So sorry, through you, the chair. Thank you so much for your comment as well. We're excited about it as well to do it in that manner. We're fortunate to be part of the Alliance for Healthier Communities, where most of the folks who are transitioning from CTS to HART Hubs are also members. So we do get to have some inside information about how that's rolling out. It depends on the community, right? So there are some smaller communities where the CTS was located in one place, and it's transitioning into a HART Hub in the same place. There are communities that are partnering with one or two different partners, and then there's communities like ours who have more partners, upwards of five funded partners, and then 20 plus other partners in the community.
Great. In my experience, a broader network is a broader safety net, so I think that's really good. I just want to make sure we're not the only ones trying that. So awesome. Thank you.
Councillor McCabe.
Thank you, and thank you for the work that you've done in a pretty short period of time to bring this online. And I would assume that there's a lot of work needing to be done with the participants, people who are at the CTS as well, and like transitioning them to the HART Hub, and hopefully not losing them or losing touch with them. I mean, in the process, I imagine that's going to be quite a bit more challenging. But I'm just wondering, do you, even though, like as Dr. Wong said, there was an increase in the amount of funding, are you, what happens if the system is kind of oversubscribed? Like, is there going to be wait listing for this, and what happens in situations like that?
Through you, the chair. Wait lists for a HART Hub?
Yes.
Okay, I'll pass that over to Tar.
Through you, the chair. Obviously, the ideal scenario is no. I think it defeats the purpose then of the intent of the HART Hub if we have wait lists. We, at this point, we don't know how much this resource is going to be utilized. And we will certainly be keeping close track of how closely it is utilized. We also know that it's not sort of a given that everyone who's currently accessing the safe consumption site will indeed avail themselves of HART Hub services. So that will be an interesting thing to be closely monitoring as well, but we are hopeful that we will not have wait lists for these services.
Yeah, I would hope so too, because as you know, when people are ready for service, that's the time to work with them. I'm not sure if this is a you question, but I was curious because when the HART Hubs were announced, there was also an announcement about some funding for supportive housing beds that went along with this. So just wondering what's happening on that front.
Yeah, through you, the chair, thank you for that question. That was the piece that I was speaking about the mental health and addiction supportive housing.
Okay.
So there was quite a bit of flexibility in how you approach this with respect to bringing new beds online. So the new beds will be the 12 transitional housing beds, so that new transitional housing program. And then in addition to that will be some rent supplements to allow people to move into permanent housing more affordably.
Okay. Is that anywhere near the need, going to meet the need we have, do you think, in in our region?
To meet the need, no, there's many people on on a wait list for supportive housing and for affordable housing. You're right. This program is a targeted program to provide support and stability to ensure successful housing after. So we would have loved 100 beds, but what we have here is 12 beds with really intensive support to allow them to be successful in housing after. So 6 to 12 months is how long we're hoping people can be in the program, and we would like to see movement out of the program so we can support more folks in.
Okay.
Really, it's about a health approach to ensuring housing stability.
Okay, and you're going to continue to come back and provide updates? I don't know if that's something we're going to request, or I just think it would be helpful if they, if additional updates, like, I don't know, twice a year, something like that, because it's good information, I think, for us to know.
Yeah, and through you, the chair, yes, we would love to provide updates. And what we're trying to do here, specifically with House of Friendship, is learn a little bit more about this model of housing as we grow into Friendship Village and as we grow House of Friendship's supportive and affordable housing portfolio.
Thank you very much.
Councillor Wolf.
Through you, Mr. Chair. Again, thank you for your report, and I appreciate what you're trying to do. From our studies so far, it seems to me there's actually no substitute for supervised consumption services. Extensive local consultation has made that clear. You've got, and what I'm worried about is this gap period. I'm glad to see that you're going to bring in 12 supportive beds. According to the Waterloo Region Drug Action Team, there's 291 years wait list for supportive mental health and 253 days for voluntary treatment for drug addiction. So 12 isn't going to cut it. What are your greatest fears during this gap period?
Through you, the chair. The gap period between the housing, or can I clarify?
The end of the consumption the CTS, and when all of these beds and things are going to happen.
Yeah, so we are working with as we wind down the CTS, the HART Hub is winding up at the same time, and we do have a number of different mitigation strategies in place to look at what gaps there are in terms of the harm reduction services. We did mention some of those already. Is there anything, Dr. Wong, you'd like to add?
Yeah, and just for your awareness, Appendix A lists them in more detail. The actions that we'll be taking with partners to try to, reduce to the extent possible, of course, the effects of no longer having a CTS. Thanks.
Okay. Anything else?
Yeah, I was just going to say through you, the chair, obviously our biggest fear is people overdosing from toxic drug supply. I mean, I think that goes without saying. And HART Hub does not replace the CTS, you're correct. So we're attempting to build capacity so that people know the places they can go for supports. And I know we are going to have 12 transitional beds. That's not the only service provided in HART Hub, right? So the teams that are already in those places where we know folks are accessing toxic drug supply will be larger, will be more present, will be in more locations, and will have additional expertise in addictions and mental health so that if they can't access a bed, they're still going to be able to access services through a variety of different ways. The 12 beds, you're right, probably will not be enough. But what we heard from the community is that we don't have beds where people can go who are interested in recovery, and we don't have beds where people can go who are coming out of recovery and then be successful in maintaining their abstinence. So that's what those beds are targeting.
Okay, thank you.
Councillor Craig.
Well, thank you, Mr. Chair, and I appreciate the presentation today. My concerns, and perhaps Dr. Wang could help me on this, because it's more of a direct criticism than anything in terms of an observation, but we have coming in 12 beds. We have over 10,000 people who are accessing drug paraphernalia in the region. We have about 2,000 to 3,000 using drugs daily. How does this in any way mitigate what's going on? It seems to me to be totally inadequate. And that's not a criticism of the concept. It's a criticism of the size and the functionality of it in terms of its limitations financially.
Thank you for the question, Councillor Craig. Yes, so ourselves, along with our community partners, are putting in place programs and services which have been authorized and funded or cost shared in some circumstances with the province that they believe is the right action or actions to take in order to try to address the opioid crisis, which we know is growing. And our community is not alone in that this is an issue that all communities in Ontario and Canada are grappling with. And so government has put in place various initiatives. Previously, one of those was a CTS, and there's been a change in direction, and now they have decided to authorize and fund what's known as the HART Hub model, which includes all the services that our presenters mentioned, and with a certain percentage of that funding going to affordable housing, supportive housing. So it is actually the government that determines the funding pot and the types of services that will be allowed and funded. So our role here, along with the partners in our community, is to try to take advantage of these funding opportunities and get as much funding as we can, put in place programs and services that we think within the parameters of those authorized programs that we think will provide the best results for the money that will be given. And so, that's what we've presented here to council today, understanding that, it is a very difficult challenge, the drug addiction and overdose challenge that we face in our community. And there are also many other services that are not necessarily receiving provincial funding that still play an important role in continuing to try to address these challenges. They're not either not covered by the province, but could have other funding sources, community funding sources, for example, or sometimes federal funding sources, like our harm reduction partners provide. There's also other services that the province provides, but not through ourselves. Well, in this case, it's still not to ourselves. CTS funding was through us, but HART Hub funding will not be through the region or public health. It will be from the province to the HART Hubs. So, for example, the mental health and addiction services, they're funded separately through the ministry, to the partners. So so this is one type of intervention, or I should say a suite of programs and services that, we had the opportunity to apply for. Unfortunately, we got, and we think this will help address the opioid challenge that we face. Thank you.
Well, if I may, Mr. Chair, would you not agree that what we're doing, what we've been provided with, falls far short of what we need to do in this region in terms of dealing with mental health, addiction, and everything else? This seems minuscule in terms of an approach. That's all I'm saying.
Oh, for sure, I think.
I'm putting you on the spot. I don't mean to do that, but I have to ask this because it just seems far out of proportion.
Yes, for sure. I mean, I think many would agree with your comment that there's much more need than there are resources at this time. What action we can take with the parameters we've been given is to do the very best job that we can and to demonstrate to this government that their investment of services in our region was the right move, and hopefully continue to build on that to advocate for more funding in the future.
I appreciate your comments. Thank you.
I think what we're doing is the best we can with the resources that the province has allocated to us, and the region of Waterloo is not unique to any other municipality in the province of Ontario. I'm looking for committee's guidance here. We have a hard stop at 12 o'clock, and I'm wondering, we still have 5 more speakers. If committee would agree to
Mr. Chair, if the hard stop is for me, you can move it.
We can move it? Okay.
Yes.
Okay. So second question is lunch has been served. So I'm not sure, can we wrap this up in 10 or 15 minutes and finish this item while we have our guests here and then do a break for lunch? Does that work for everybody? Okay. Chair Redmond.
Thank you, Chair Erb. I really want to commend our community for rising to the occasion, and Dr. Wong has sort of touched on my attitude towards this is a down payment on services that we have been advocating for decades in this region. So I have two questions, and I'll ask them both to be expedient. One is, I'm very interested in what kind of reporting and data that the province is asking for, because I think that's very interesting. And another question that has occurred to me, there's been so much talk about the mandatory rehabilitation of people dealing with drug addiction. We know that there is an unmet need of people who voluntarily would go into these services. Is there anything in this model that precludes people who would voluntarily go in to drug rehab, but the space is not available to come in through the HART Hub model?
Through you, the chair. I can answer the first part about the data, and then I'll pass it over to Tara. We are working with the province to sort out what the evaluation looks like and what they're asking for. We do have data that we're already monitoring and collecting on an ongoing basis. On our website, we have a dashboard related to opioids, suspected overdoses. That includes paramedic service calls, emergency department visits. So we are continuing to monitor some of those indicators and working with community partners to see what they're seeing as well, and looking at evaluating the transition and opening of the HART Hub and what clients are accessing those services. And I'll pass it over to Tara.
Yeah, through you, the chair. Thank you, Chair Redmond, for your question. We, as you know, will get the traditional monitoring through the funding letter. We have not yet got all of those pieces. And then we have been told that there will be a dedicated team doing evaluation across the pilots, across the province. So assumedly there will be more rigorous data being collected. And then of course there's data that we want to look at specific to our community. And as we build that out, we'll certainly make sure that we keep you informed of those pieces and share with you, updates about the data we're collecting as often as we're asked to do so. So that's what I can commit to. As far as your other question, I want to make sure I understand what you're asking. I think you're asking if HART Hub will be a pathway for individuals seeking rehabilitation, addiction recovery formally. Is that correct?
Who voluntarily would seek it now, but the services, they're on a wait list.
Yeah. No, great question. Yes, absolutely. And I think, as we know, change orientation is important to successful rehabilitation. Even for folks who are change oriented, it can take up to 7 times through a rehab program to be successful. So that change orientation is important, whatever it may be and at whatever stage it may be at. And what we heard was that often the barrier to folks accessing the services, and I think someone here spoke about it, is that when folks are ready for change, there needs to be services available. And that's sort of what we're really endeavoring to have the HART Hub do through all those different pathways, through the teams that are currently embedded in the community, and then through a process that links someone to a coordinator that stays with them throughout and gets them through each stage of that change to make them as successful as they possibly can be in their self-determined journey.
If I could just say thank you very much for all the work you're doing. And again, I am just so proud of our community partners and the fact this is a systems response that will be available right across the region to everyone who needs to avail themselves of it. So thank you for the great work.
Councillor Vanovic.
Thank you very much, Councillor Urban. Really just want to take a moment to not ask questions, but just offer my thanks and appreciation to staff on two fronts. Number one, for all of the work that has been done with the CTS, both from a staff and a community partner point of view. It has played an important role in our downtown community. And we're sad to see it go. Our council did pass a motion to that effect, as has been noted. And I also do want to express my thanks, however, that we are seeing this investment being made in the HART Hub. I think we all wish that it was happening in a timelier manner, but it is moving forward, and it is a down payment, as has been noted. I think our staff have done incredible work with our community partners in getting this together, and it'll play an important role in supporting residents in our community who are dealing with these issues and are ready to look for a path forward in terms of better health outcomes for themselves and those that care for them. So just really want to take this opportunity to publicly acknowledge both bodies. I will also say that as a city, we continue to deal with a number of the issues and we've raised these with the region, with WRPS and others, that are challenges in the downtown. The city, together with the downtown, has made a substantial investment in both downtown ambassadors and other initiatives to both support these residents as well as create a safe and welcoming environment for everybody who frequents our businesses, restaurants, and special events. So that just wanted to take this moment. So thank you, Mr. Chair.
Councillor Leggett.
Thank you, Mr. Chair. So my question with the dollar amount of the funding. Have you had any discussions with any of your colleagues throughout the province? I understand that you get for meetings and things, but have you had a discussion about what you think would be the optimal amount of money? It's 396 million over 3 years, I believe, which is 192 per year for the whole province, which is not nearly enough. So if you and I would assume this is going to be front loaded as well. So have you had a discussion? My thought is about $1 billion a year would get us to where we really need to be within 3 to 5 years. But I'd like to hear what your thoughts are on that, only because some of us, when we're having our conversations with the ministries and the Minister of Finance and the Minister of Health, I'd like to be able to take something forward in my conversations as to need, other than just my own thoughts on that.
Who wants to respond to that?
Thanks. Through you, the chair. Do you have a Tara? Do you have a
Dr. Wong?
Yeah, I think we might have to take that back and get back to you, Councillor Leggett. But yeah, we definitely recognize that we would need much more support. But as Chair Edmund has stated, this is like a down payment, and so right now, we haven't really we've been focused on how do we A, get the funding, B, get up the services as quickly as we can, while continuing, to work with community partners and municipalities to make sure that, these services are well received in our community. So our attention has been focused on that, but I'll see if, Tara would like to add anything, or Jennifer, but might have to take it back.
Thanks. Through you, the chair. What I can say, we have not sat down and crunched numbers. We certainly could do so. I think, as we know, we're currently in an environment where there's need across the healthcare and mental health and addiction sector that's hard to put a price tag on. But what I hope is that as these HART Hubs roll out across the province, that the community of practices that we've committed to engaging in provincially will take some of the innovative approaches that are happening across the province and learn. And if given the opportunity for additional funding at the end of the 3-year pilot, take that sort of innovation and best practice and move it out across the province. Because I think that's what we what we can really lean on as we go through this pilot is learning about approaches that are effective, learning about approaches that efficiently spend these resources in a way that actually makes a difference to the people that they're serving and the communities that they reside in. So that's what I'm hoping we get from this. Hard to put a price tag on it until we understand what those successful services are, but I'm hoping we get some really good evidence-based practice research that comes out of this pilot.
Thank you. And I say, you know, with announcements today, the last couple of days, there's going to be a drastic loss in revenues. So I think that sooner rather than later, with some sort of dollar values that we can go forward with to press for this, would be extremely helpful. So thank you so much for that.
Councillor Craig.
First of all, if I may, Mr. Chair, I appreciate the updates today, and my comments in no way are a criticism of the presenters and what they're doing, what they're trying to, unpack for us in terms of the HART Hubs. My concern remains with the fact that when you look at the recovery statistics for people who have addictions, and if you look at the number of mental health issues we have, and if you look at the number of people accessing drug paraphernalia or using drugs daily, the down payment that we're making today, or has been made by the province, is minuscule in terms of the overall issue. That's the concern I have. And I think that's what we have to start looking at. What is the issue here in terms of overall needs, and what else should we be asking for? Because I don't want the public to walk away today thinking this is going to solve the issue. It's only a tiny part of solving the issue. I do thank, again, the presenters. Thank you.
Thank you. Thanks for the presentation. Thanks for all the work you're doing in such a short period of time to create this new program for us. Thank you. So we are going to take a recess and reconvene at 12:40. So down to the Waterloo County room. Okay, thank you. We now have quorum. I saw Natasha walking out. I'm not sure if she's gone for the day. Yeah.
Yeah.
Okay.
We do have quorum now.
We will reconvene this committee meeting. And thank you, Chief Riches, for your patience. I hope you brought your lunch with you. So we're at item 8.2.2 and item 8.2.3. I understand you're going to be speaking to both of those. So the floor is yours.
Thank you, and through you, Mr. Chair. Good afternoon, CHS Committee. I'm here today to report or to provide a brief presentation on two reports before you for your information. One is on our key performance indicators for the year 2024, and the other is on our response time performance plan, which is actually a separate requirement, legislative requirement, and by the end of the month, I have to submit that response time performance plan results for 2024 to the province as per the Ambulance Act, which is why I'm here in front of you today. Can you go to the next slide, please? So this is just a summary slide of what I'm going to be talking with you about this afternoon. First off, you'll see significant improvement and or moderate improvements when you compare 2023 to 2024, which obviously we're very pleased about. It goes without saying that those improvements can't happen without the hard work of the paramedics and logistics staff that work for Region Waterloo Paramedic Services, but also can't happen without the corporate support and support from areas like IT services, legal, HR, and finance to make sure we can deliver really great programs, so we're thankful to them. I would also like to acknowledge the presentation done prior to the lunch break about the HART Hub. The HART Hub is very important to paramedic services. Obviously, we support through the 911 response system a number of patients who are dealing with mental health and addictions related issues. And so a successful HART Hub hopefully in the future will allow us to create alternative care pathways, which means we can reduce demand on emergency departments. Because right now, if the HART Hub was open today and my paramedics were to respond today to a call and that patient said to us, I want to go to the HART Hub, we actually don't have the legislative approval to do it. But we are hoping to work with the HART Hub. We are actively engaged with their operations committee, and the work that House of Friendship and Community Health Caring KW and Public Health are doing is really instrumental to us moving the needle on our responses to those calls. So I would like to say thank you for that to them. You'll see that if you've had a chance to read the reports, vehicles responses increased compared to 2023. Even though there was an increase in the number of vehicle responses, there was a decrease in the unit utilization, which is obviously an indicator that the investments that Council has made and other strategies, mitigation strategies we are doing is working, the combination of those two things. We have seen an overall response time improvement relative to 2023. And probably one of the biggest things we're really pleased about is the ambulance offload time significant improvement, and I'll get to that in a future slide, but it is has been a real win in the last 12 months. As you will remember, in the fall, we came to you with telling you we were changing away from code reds and code yellows to changing them to new terms. And code 0, which was formerly code red, we've seen improvements on, and code critical, we're still analyzing, partly because under code yellow, it was 3 ambulances or less available, and we changed that threshold in order to apply mitigation strategies. So the analysis is still ongoing there. But you'll see that in many of the areas, we have an improvement in everything to do with resource availability, which is very helpful. Next slide, please. Getting into it in a bit more detail, we've seen a 2.7% increase compared to 2023 in terms of vehicle responses. I will note for Council that these are the vehicle responses to all the 911 calls we respond to. So in terms of unique 911 calls we respond to for 2024, there was just under 54,000. So that shows you that on a number of calls, we're sending more than one resource based on what's needed. But both numbers together kind of work in conjunction to tell us about system health. So about 22,000 more vehicle responses, and our projections, and these are projections, it's not just based on a single year over year, it's over time, a defined time period of a number of years. By 2026, we are expecting that if nothing changes, we could hit the 83,000 vehicle response mark by the end of that year. And then in terms of unit utilization, really, really great improvement in there. You'll note that in 2023, our unit utilization was 48.8%, and we've been able to drop that by 8.4% year on year, which is really significant. And I can tell you that our paramedics are seeing that they are not as overwhelmed in a 12-hour shift as they were. We are seeing a reduction in missed meal breaks for paramedics, for example, and a reduction in forced end-of-shift overtime, which are really important for our staff. Next slide, please. In terms of the 80th percentile response time, there is an improvement of about 22 seconds for the whole region between 2023 to 2024. And we've seen improved response times in all municipalities except for North Dumfries. But there's a slight increase in North Dumfries of about 28 seconds at the 80th percentile. And there's a lot of different factors for that. And for a brief explanation for you, there are much less calls in North Dumfries. So because of that, when there are outlier calls that exceed our response time target, they actually affect the average much more significantly than they would in some of our urban centers, just because there's less calls to compare it against. And the other important thing here is that these response times and the stuff about unit utilization does really show that our performance is improving. I'm always mindful, Councillor Schantz asked this a couple of years ago, when will we start to see that the investments are working? When will we start to see system improvement? And, I'm standing in front of you today saying that we're starting to see that needle really turn, and to thank Council for their investment in us in the last couple of years. The other thing that is happening is, as you are aware, we use a master plan to identify our strategic priorities and our investments required over time. And so we have a current master plan that technically expires the end of 2027. But because of the change in things since the pandemic and how much so many things in the system has changed, we are hoping to bring forth you a brand new master plan that will take effect starting in 2026, sometime hopefully May or June. And that's being done by a third-party consultant who we're working really closely with. And that will kind of set the course for paramedic services from 2026 to 2035. We've picked that 10-year time frame on purpose because that's also when the new hospital comes online and changes to the hospital system occurs. So we wanted to make sure we captured it in the 10-year window. Next slide, please. As I mentioned earlier, we're really, really pleased about these metrics, and they speak for themselves on the slide. We were losing an average of 32 hours per day in 2024, but that was 42 hours per day in 2023 for ambulance offload time. So that 10 hours per day goes right back into the system, which is why response times are improving, which is why end-of-shift overtime is reducing. It's why all those things are happening. And so that's a significant improvement, and kudos to my leadership team who meet every 2 weeks with every single hospital leadership, executive leadership to work on this. And I'd be remiss if I didn't shout out to the senior executive leadership at all 3 hospitals. They have made this a priority for their entire hospital system. Ambulance offload times are now a metric that is shared through their entire decision support through their whole hospitals, which previously ambulance offload time was considered a metric only in the emergency department. And so now it's a metric for all 3 hospitals, and we have seen real significant buy-in. And as you'll see there in Q1, which was January to March, at the 90th percentile, it was taking us 124 minutes to offload patients, which means 90% of the time we would show up, we would be on offload delay for 124 minutes or less. In the last quarter of 2024, that dropped to 50 minutes. And that's really, really significant. That's 74-minute improvement on 53,000 calls. You can imagine the system improvement that creates. So kudos to our hospitals and to my leadership team for not giving up on this one. And it's really improved. Next slide, please. In terms of Code Zero, critical capacity, that is formerly Code Zero was formerly Code Red, and Code Critical was formerly Code Yellow. So this will probably be the last time I refer to them as Code Red and Code Yellow, because we have to get used to the new terms. But you'll see that in terms of the statistics, and it's also in the actual eScribe report, you'll see that we've seen real improvement in all areas, which again is an indicator of 2 things. 1, council investment in the enhancements that we've received, and 2, the offload delay metrics really also do move that needle as well, because if we have our resources stuck in the hospital, then we're going to have less resources available in the community. So we're really pleased about that. And for code critical, we don't have as much data to report at this point because it is a different threshold now, as I mentioned. Previously, code yellow was 3 ambulances available or less. Now code critical is 5 ambulances available or less. So we would expect the number of code critical events to increase, but that's okay because they're increasing at a higher threshold, which allows us to put in mitigation strategies to make sure we never get down to that code 0 point of view. So we were expecting that bump, and we'll give you more analysis on that next year. So that's the key performance indicators. Next slide, please. In terms of our legislative requirement to the province, I do have to report on our response time performance plan, and once council accepts this report for information, I can submit it to the province by the end of March, as is required by the legislation. We meet all the Ministry of Health compliance targets, and we saw a decrease in the targets, or an improvement in the targets for CTAS 1 to 5 responses, with a slight increase in sudden cardiac arrest responses. And despite all the system pressures, we think we're doing really, really well. I would like to explain to council how the RTPP works, because it is a kind of somewhat convoluted reporting metric. So the CTAS levels, which stands for Canadian Triage and Acuity Scale, is applied by the paramedic once they arrive scene and assess the patient. CTAS 1 is your sickest patient, CTAS 5 is your patient who is not as sick, and everything in between. The challenge with that is our response times are measured against that assessment, yet we are not dispatched knowing how sick the patient is on the other end, if that makes any sense. So when the dispatchers send us on a code 4, which is our current thing, lights and sirens, we try and get to every single call, or they send us on a code 3, which is a non-lights and sirens response. It is quite possible that at the end of that code 3 call, which is not urgent, we end up with a patient who's actually a CTAS 1 or a sudden cardiac arrest, and we're measured against an assessment score we apply upon arrival. So it's a really convoluted way. Myself and other chiefs across the province are constantly working with the province on how to improve this reporting metric. And I do think the biggest improvement will come at the end of the year, which I know council's happy about, which is that's when the new dispatch system gets put into Cambridge CAC, called Medical Priority Dispatching Service. And that MPDS is much more in line with CTAS. So we do expect that for 2026 anyways, we will be able to report in early 2027 that those numbers more align. And hopefully my explanation helped with that. Next slide, please. As I mentioned, we did see a slight decrease or worsening of the response times to sudden cardiac arrest. However, the Ministry of Health sets a target of 50% of the time we need to arrive on scene, or a defibrillator needs to arrive on scene within 6 minutes or less. This metric is also informed by fire department statistics. All of your fire departments provide us how quickly they get to sudden cardiac arrest calls with a defibrillator. And so we're still well above the ministry target. For years, the target for the region of Waterloo has been 70%, which gives us something to strive for in terms of best practice and system improvement. So you'll probably not hear a recommendation from me to lower the target. We want to keep it where it is, and we'll just strive to keep it, trying to receive it, knowing we're always going to meet the ministry's target or beat it. And next slide, please. For the rest of the CTAS levels, you'll see in that chart, which is also outlined in the report, an improvement across all CTAS times, which is really good. But again, I remind you that the CTAS are applied by the paramedics once they get there. And so, you know, you could, and I'll give you an example, you could get a call for a patient who's experiencing nausea, and that's all you think it is, and you arrive there and it's someone having a heart attack, and suddenly their CTAS jumps. But we're measured against the response time as if we knew it was a heart attack to begin with, if that makes any sense. So that's an issue that we're continuing to work on provincially and locally. A quick reminder that next slide, please. A quick reminder that we have changed the response time performance plan targets for this calendar year. That was something you approved in the fall. So you'll note that all of the targets in the second column there for CTAS 3 through 5 have all increased. And we've done that quite on purpose because our system should be designed to prioritize our resources for the sickest patients first, just like an emergency department would triage the sickest patient first and support that patient first. And so these new targets really do, it kind of says to us, this is what's important to us. And it also is in keeping with our comparators across the province. If you look at Hamilton, they do the same thing. You look at Halton Region, they do the same thing. So we wanted to make sure we were comparing apples to apples in terms of system performance. Next slide, please. In terms of mitigation strategies, as I've already mentioned, we're preparing for implementation of the MPDS system at Cambridge CAC, which will occur on December 10th, 2025. We're actively engaged with the ministry, even though the last few weeks they've been in caretaker period, so we haven't heard much from them. But once that gets changes, we'll continue that work. We are not going to take our foot off the gas regarding offload delays because we know that there's still more work that our hospitals can do, even though they've had amazing improvement, and we know that they're committed to that work as well. We did just submit a funding proposal to extend for another year for the designated offload nurse program, which has been really, really effective. And I can tell you that the Ministry of Health uses the Dawn P program, the example from our hospitals here in the region, as a way for other hospitals to say, this is how we want you to use this money. So we're really pleased with that. We want to continue expansion of patient care model standards, which are new standards in the legislation that allows us to do things like treat and release from the scene, treat and refer, and alternative destinations. And if I could connect that back to the HART Hub presentation, that the HART Hub work and the work that those teams do becomes really important to us because we want to establish an alternate destination pathway with the HART Hub, but also in conjunction with that, a treat and refer pathway, which means we go to a 911 call. Once we know that the patient is eligible for, say, Sanguine's mobile team to come and take over care, then we'll do a warm handoff of care and allow that, which means our paramedics can be released. I want to make it clear to council that's a future state. We can't do that now because we do need Ministry of Health Emergency Health Services branch approval for that, but that is our end state, and we think that the HART Hub is a viable option for that, and we're really supportive of that model. The other thing, as mentioned, right now council's approved our shift to the high growth scenario for the master plan. I do hope that we'll be able to give you a master plan in the coming months that allows you to see a sustainable investment in paramedic services as populations continue to increase, as well as call volumes continue to increase, and we're going to manage call demand effectively. And then finally, the last thing, which you'll see in a couple of months, you'll see a report for consent on, is our community paramedicine program. And that is work that is 100% funded. There is no tax levy impact to that. It's 100% funded by both Ontario Health and then primarily the Ministry of Long-Term Care. And we think that the role of community paramedics can play in reducing the demand on 911 systems is really significant. We're going to continue that work. So that's my report, and I'm happy to take any questions.
Thank you. We have a number of questions. Chantal, excuse me, Councillor Unick.
Thank you, Chair. Thank you, Chief Riches, for coming. Thank you for all this great news. It's good to know that our KPIs are improving in every sense and that our hospital partners are on board. And most importantly, that your staff and your teams are feeling the good and positive differences. You alluded to this in noting that we were exemplary to the province in terms of the Dawn P program, but I wonder if you want to speak to where this puts our region relative to other comparator municipalities. Like, are we industry leading at this point? Are there further things that we need to improve upon? How do we compare, I think is my question. But also just thank you for coming.
Thank you. Through you, Mr. Chair, appreciate the question. Specifically related to the designated offload nurse program and offload delay metrics, every month the province sends us the previous month's metrics for the entire province. And a couple of years ago, I would argue that the regional Waterloo hospitals were probably not in the higher bracket compared to other municipalities in the province and locally. We are starting to see significant improvement in that regard. So last year, for example, Guelph General was doing very well, continues to do very well with ambulance offload times, but now regional Waterloo hospitals are very comparable to Guelph General. I can probably prepare something in an email with Commissioner Wong's approval to give you a bit more of a fulsome response to that on the data in terms of how we compare to other hospitals, if you'd like.
Okay, thank you.
Yep, thank you.
Councillor Foxton.
Thank you. And Chief, what a well-done job. I had the privilege of sitting in the last master plan and evolving that. And year after year, we've come here and we've talked about how hard it is and the offloads and everything else. And well done, Chief. So well done that I don't even mind the 20 seconds late delay in North Dumfries.
Appreciate that. Thank you.
Councillor James.
Thank you, through you, Chair. Thank you so much for the update and presentation. I do have a question. I'm going to try and ask this in the most palatable way, I guess. When you're collecting, you mentioned like the CTAS and the reporting and the discrepancy there. Do you keep the data, like is that tracked and how much, say it's a 5 and it should be a 1 or vice versa? Yeah. Is that tracked at all and compared, be it locally or provincially? And then the second part of that question is, does that impact future kind of training for the the dispatch in terms of recognizing, like, does it trigger anything like that?
Through you, Mr. Chair, thank you for your question. In terms of tracking, the challenge is that the current system we use, which council's heard myself and previous chiefs report on, is kind of antiquated. It's called DPCI, Dispatch Priority Card Index. And it's not a very, that's what I'm looking for, nuanced or very sophisticated system. People say, yes, I'm sweaty. Suddenly that becomes a code 4, quite honestly. And the challenge with that is that when you compare that to paramedic applied CTAS, it's hard to compare. We do track, and when we see things like, hey, you gave us this call to us on a non-emergency basis, but it turned out to be really critical. Yes, there's a conversation between us and the Cambridge Central Ambulance Communication Center leadership. They want to see significant improvement as well. I know we work very closely with them on this MPDS implementation. They're really, really excited about it. I can tell you, someone else asked me this as well, and it's related to your question, Councillor James. The ambulance communications officers at the Cambridge CAC are going through extensive training to get ready for MPDS. It's like 64 hours worth of training that they've got to do, which is really significant, a huge investment by the province in their staff in that regard. And that also includes them becoming accredited under the International Academy of Emergency Dispatchers, which means now they have an accreditation standard they have to meet. And we all know how important kind of setting gold standards is. So I do expect that the new dispatch system will be much, in terms of data and data analysis, will be much more easier for all of us to manage. And, you know, I'd be remiss if I didn't compliment the province on its overall strategy to implement the MPDS across the entire province. They've now done it, I think, in 8 or 9 different CAC centers, and they're doing 2 or more before the summer, and then you'll see Hamilton CAC and then us. So this is a real big project for the ministry, and we do expect that we'll be able to compare apples to apples a bit more, if I can use that analogy for you. It is a real challenge, though, because I can say from a staff level, it's really frustrating for our staff to think they're going to an emergency, rush to the emergency, it turns out not to be one, and vice versa. It's a real challenge for them to respond to a call that they don't think is an emergency, and then it turns out to be someone really sick on the other end. Because how you prepare your brain to respond to those calls is differently when you're responding. So I think we're all really excited about this improvement. I'll share this with, I started in this job in 1995, 96, and I was told then that MPDS would hit the province by the year 2000. So here we are in 2025 and we're getting it. So this is long overdue, if I may. So
better late than never. Thank you so
welcome.
much,
Thank
Chief.
You.
Patience is a virtue.
Yes.
Councillor Schatz.
Thank you. Just want to say I was very excited to see the offload delay numbers, and you mentioned that I've spoken about it a number of times, so I'm glad to see that that's improving, and thanks to everyone involved, the paramedics, and you, Chief, for your leadership. Good job.
Thank you. If I may, Mr. Chair, it's important, and I know Council recognizes this. This is not a one-person effort or initiative. We have a team of almost 400 at Paramedic Services, and then you think about all the hospitals and their executives and their teams and their nurses and their orderlies. Everybody's part of the solution, and that's probably the thing, if I may, Councillor Shantz, that we're most excited about is everybody seems to be on board and there's buy-in across all levels of all the system, which really does result in system change. And that's the improvement we've seen. But I appreciate your comments and all the comments of council. I'll make sure I take them back to our staff. Thank you.
Councillor McCabe.
Thank you. Yeah, and thank you, as others have said, for it's always great, as we've seen in some other divisions today, it's always great to see improvements and meeting goals and exceeding them. I'm just curious, I wanted to make sure I understood what you said about the response times.
Yep.
Did you say there's 74,000 responses, like calls that paramedics go to, but and 53,000 that fire and police are also at? No, okay.
No.
I'm really actually
Yeah.
curious, how many times do paramedics go when really only paramedics are needed? But you can give me different numbers, whatever numbers you've got in your head.
Okay. So through you, Mr. Chair, if I can clarify that, and I appreciate your question. So because of workload, one of the metrics we look at is not just the number of calls that we're required to respond to, but how many resources we send to those calls.
Mm-hmm.
So in 2024, we did just under 54,000 unique 911 calls that paramedic services had to respond to. Within those 54,000, because of the complexity of the call or the different reasons we needed certain resources, there were 74,000 vehicle responses to those calls. So that's the connection there. So hopefully that cleared that up. I don't have the data in front of me today to tell you how many of those calls police and fire also responded to. I can tell you that we work closely with the fire departments on tiered response agreements, as well with police on what calls do we both need to go to, do you go to versus we go to. And that's an ongoing moving target, because as you can appreciate, all three emergency services have different legislative mandates. So sometimes we all have to go, even though, legislation requires us all to go, even though maybe only police are needed or only us are needed.
Right. And so when the medical priority dispatch or the new systems in place, will that help with some of that? Or, I mean, I guess do you know if there's legislative or regulatory changes that are going to accompany that? So it's like the ones who really need to be there only are having to respond?
Through you, Mr. Chair, great question, Councillor McCabe. We have not received necessarily a legislative mandate to make changes. However, we are actively working with all the local fire departments about right-sizing the tiered response agreements that we have. And I've assigned a superintendent directly to the MPDS implementation, and part of his job is to kind of let's make sure all the tiered response agreements work for everybody. We have almost the same tiered response agreement currently for the three urban municipalities, because they're all very similar in terms of call volumes and call types and those types of things. We have different tiered response agreements for the four townships, and we want to make sure, and we have some commitment from local area fire chiefs to discuss how do we make sure that the right calls, the fire department is responding to the right medical assist calls, and we just right size it all. When I speak to the fire chiefs, all of them are quite aware on the demand on their resources for medical responses, and they want to make sure that everything is right sized so that none of the emergency services want to go to a call that they were not needed at. Mm-hmm. Let's just make that clear, because it's a demand on our resources, on our staffing, it costs money, all those types of things. So I don't know when we will change the tiered response criteria, but one of the lessons we've learned for the other municipalities who implemented MPDS before ours was have these discussions early and often before the light switch gets flipped, and we've done that. So we are hoping to produce more current and more future-ready tiered response agreements with our fire departments.
That's really good to hear.
Yeah.
And just quickly, if you can you give an update on where we're at with the alternative destination?
I
Site
can.
or clinics?
Yeah, through you, Mr. Chair. Unfortunately, we've not seen the progress on that project as much as we would like. And that's why we're as excited as we are about the HART Hub, because right now the model, we don't have a viable model right now to do an alternative destination too, but we really believe that the HART Hub model could provide us that. And so we're really trying to support the HART Hub model because that's where the funding is. And at this point, unless I am mistaken, the funding for the ICC model has not come through. I'm looking at Dr. Wong and she's nodding her head like this. So, so unfortunately that project is, I would say, behind where we want it to be in terms of outcome at this point. But we're looking at any and all alternatives that we can to change it. So.
Councillor Liggett.
Thank you.
Thank you, Mr. Chair. John, do we have ambulances on order now?
Through you, Mr. Chair, yes, we put an order in the summer of 2024 to support our 2025 and 2026 enhancements and replacements.
And where are we at with that? Do you think they're going to do they have to go back and forth like cars, or are they a one-shot deal? Where are they coming? I'm assuming they're coming from the States. Maybe I shouldn't assume that. Maybe we're good at manufacturing ambulances. So can we talk to that, especially with all the announcements today?
So through you, Mr. Chair, and a great question, Councillor Liggett. The ambulances, the patient care compartments are built in Canada, but the chassis that they go on is from the US, just like many, many other vehicles. And so, I don't have a final number for you yet. We are working with the vendor with the purchase order to understand if there's going to be a change in the chassis price as a result of what you're speaking about, Councillor Leggett. And it's not just ambulances for paramedic services. There is other equipment that unfortunately some of the equipment does come through the US, even though we're buying from a Canadian company who then Canadianizes it. So we are working on the impact that will have on us from a capital planning perspective and working with finance and Commissioner Wong and to try to understand what that impact looks like.
Okay. Thank you, Chief Riches. These reports were both for information, so no action is required from committee. Thank you.
Thank you very much.
Thanks for the and the good news as well. 9.1, council tracking. There are no items on the tracking list. Is there any other business? Okay, our next meeting, April the 8th, 2025. Is there someone prepared to move that we adjourn this meeting? Councillor McCabe, seconded by Councillor Wolf. Use your e-scribe buttons to indicate your support. Do we know? That's carried. Thank you. So, is Michael on?